Greetings to the Board of Trustees. Welcome to the Respiratory Education Laboratory. At this time, we'll have our students introduce themselves.
Hi, I'm Don.
I'm Bobby, Carrie,
Beverly.
And I'm Nancy, and we are all second semester students at the Jefferson College Respiratory Program. We are excited today to introduce to the Board of Trustees some of our simulation mechanics and materials that help us improve our lab techniques.
As you see and look around the room, you can see a variety of equipment that allows us to practice our techniques, allows us to actually get better, make sure that we're flawless in our execution of our therapeutic interventions. So when we get into a clinical environment where there's much more risk, we're confident we can perform flawlessly.
And that's a good point, Don, because already our clinical affiliates have expressed pleasure that our students are performing very well and seem to be very prepared to enter the acute care facilities.
Today, what we would like to show the Board of Trustees is an intubation procedure on our mannequin.
There will be a lot of reasons why we would possibly want to intubate a person. Primarily, it's because they can't protect their airway, and we need to provide an alternative artificial one. The person may be comatose due to a drug overdose. They may be under severe respiratory failure. At this time, we're actually going to proceed to do this demonstration of the procedure. A lot of preparation as far as equipment goes into doing this process. Currently, Bobby's doing bag mask ventilation. She's providing oxygenation to this patient. Just enough, not too much, not too little. See a lot of preparatory action by the support staff around her. Nancy's getting ready to inspect the patient's oral cavity with a lighted laryngoscope.
Ready? Yes.
She's looking for a couple landmarks to insert that ET tube, the artificial airway. Beverly hands the tube. Nancy's preparing to insert it into the patient's trachea. Beverly inflates the cuff to make sure we seal the ET tube. At the same time, Carrie puts on an inline suction catheter, and now we are reventilating the patient. Beverly is checking the pressure on the cuff, making sure that we're not overinflating and damaging that tracheal tissue, but also making sure that we have pressure to prevent leakage. You'll see Bobby now, she's auscultating the chest, breath sounds, making sure that we're getting air in both of those lung fields. That makes us know that we've got that ET tube in the right location. Affixing the ET tube holder to the patient. This ensures that the holder stays in place during the variety of procedures this patient may be subjected to during their stay. Preparing to put the patient on the mechanical ventilation, which will actually be supplying all the patient's ventilatory needs from this point on. You see Carrie's now performing a suction, an inline suction. She's removing any of the substances that may be occluding the airway or providing difficulty for this patient to receive this ventilation. Removing those into the vacuum container, and that's pretty much the intubation process.
And we would like to say thank you to the board for your support, and we appreciate you watching our demonstration today.